Thank you. A great nation should not have millions without access to quality health care. Yet we have over 30 million Americans that lack health insurance. In my home state of Texas, 1 out of every 4 working adults are uninsured. This is just unacceptable. And out-of-control health care costs are impacting families who have employer coverage. Over half of Americans with such coverage say that they or family members skipped or postponed needed care because of cost. More and more Americans are finding that their health insurance deductible is bigger than their bank account, and a single illness can put someone into bankruptcy. Half of patients with cancer diagnosis deplete their life savings within 2 years. Americans have so much skin in the game that they're getting third-degree burns. The system is unsustainable and unacceptable. And amidst it all, the bright spot is Medicare. Contrary to Republican attacks, the seniors on Medicare aren't languishing on waiting lists, and they're not being denied the care they need. Far from it. Medicare provides our seniors with guaranteed, cost-effective coverage that they can always count on. I know many people who would love to be on Medicare. They're just a little too young. To be sure, Medicare has some gaps. That's why I've introduced bills to expand coverage to include dental, vision, and hearing, and why I've focused on prescription price gouging. A Medicare for All system would begin by making Medicare more comprehensive for those who rely upon it today. Congressman Jayapal is the leading advocate for Medicare for All. I salute her and Congresswoman DeLauro and Schakowsky for their Medicare for America proposal, and Congressman Higgins for his Medicare buy-in proposal. Each of these has some merit. We cannot transform health care overnight. We'll need to phase it in, and none of these proposals is perfect, but each one has value. Since efforts to improve the Affordable Care Act have been blocked for 8 long years, we need to move expeditiously to achieve universal coverage. A single-payer Medicare for All program would be a highly effective means of accomplishing this goal. In contrast, today's naysayers don't have any plan at all. They've had 8 years to present an alternative to Obamacare, and what do we have? Republican Nothingcare. And their great leader, President Trump, has promised a big, beautiful health care plan that cuts costs and provides better health care for everyone. But wait, that's the same plan in almost the same words that he offered in 2016 before he began attacking protection for pre-existing conditions. And now he says he has a secret plan that must remain under wraps until after he's reelected. A translation of the attacks that these Republicans are making on Medicare for All amounts to this. Democrats want to take over your health care coverage and make it as bad as Medicare is today. Well, I know a lot of Americans who say, throw us into that Medicare briar patch. Here in the Budget Committee, we're certainly concerned about a sustainable system. There is no free lunch. The cost projected for our current health care system is $50 trillion over the next decade. We're paying that bill. It's a question of how we pay for it and how we get quality services for it. Mr. Hadley, is it true that the government is already paying for most of the health care spending in the United States?
Yes, in 2017, the private sector contributed
and
just
doesn't
half.
the report that you've given us explain how a Medicare for All system could be financed more progressively than what we have today? With more progressive financing, isn't there a potential for many middle-class and low-income working people to actually pay less for Medicare for All than they do today for insurance through their employer?
Yes, depending on the design of the system, you could change how progressive it is.
As chairman of the House Ways and Means Committee Health Subcommittee, I've been particularly focused on the high cost of prescription drugs. I'm pleased that both the Medicare for America bill and the Medicare for All bill have both incorporated verbatim the text of my Medicare Negotiation and Competitive Licensing Act as the best strategy to deal with these pharmaceutical monopolies. This is a bill sponsored by most House Democrats. It offers a unique American solution to a unique American problem, that we're having to pay about the highest prices for prescription drugs anywhere in the world. We propose negotiation and competitive licensing to deal with these monopolies. It's essential that the Congress move forward on that this year, and that it be included to deal with one of the most pressing health care problems our families face today. And I yield back.